Hello, dear friends, I am with you, Sofya Dorinskaya. I am a psychiatrist and the head of the Medical Information Center. Today I want to answer a question from my viewers regarding the use of soda. I know that some people drink it, and some even put it on IVs themselves, and they ask me all the time, is this good, is this bad? Does it harm health or help? I'm not going to beat around the bush. I'll tell you straight. Consuming soda is complete nonsense. A shift in blood, especially such a harsh, drastic shift towards alkalinity, is the disruption of the blood's biochemistry in principle. This is a very severe disturbance of homeostasis. Homeostasis is the constancy of blood pH. The body always tries to keep the blood pH just slightly on the alkaline side. Just slightly on the alkaline side. And a person it's not allowed to drastically shift the blood pH in either direction, because that is always a pathological condition. What are the risks? Consuming soda, for example, if you drink it. Soda neutralizes stomach acid. Therefore, when you eat, if you drink soda before breakfast, the food cannot be properly digested, and the food bolus enters the intestines undigested as it should not. And from this, colitis develops, and so do ulcerative diseases of the intestines. From this, pancreatic pathology may develop as well as liver pathology. By itself, the destruction of stomach acid leads to various stomach diseases, and it also results in severe vitamin deficiencies. I already have a video about the dangers of uncontrolled use of antacid medications. Antacids are against acid. And all such medications, when they are not used in courses but are prescribed for a person to take for the rest of their life, lead to severe vitamin deficiencies. I want to remind you that vitamin deficiencies are life-threatening conditions. What does it mean, a life-threatening condition? It doesn't mean that a person feels perfectly fine, has some vitamin deficiency, and then suddenly dies. No. A life-threatening state of vitamin deficiency. It means that the body is slowly being destroyed, and the person experiences pain. At the same time, since the pain is disseminated, meaning it is not localized, it is sublimated into very severe emotions, despair, depression. This can even progress to neuroses and severe psychoses with hallucinations. That can happen. Therefore, when you interfere very harshly with the body's functioning using substances like baking soda, you are simply leading your body toward illness. I want to remind you that vitamins are acids, and when the blood pH shifts to the alkaline side, vitamins begin to break down very rapidly. And this is yet another another mechanism that leads a person to severe vitamin deficiencies, to very terrible, unpleasant suffering and early death. Personally, whenever someone talks to me directly, I have never met a single person who drank alkaline water or consumed baking soda or used it as drops, and who actually felt good as a result. I have an example of a person who used baking soda as drops. And based on the symptoms, the descriptions, the clinical picture, and the illnesses this person described to me, it felt as if the person was simply dissolving before my eyes, as if they were just disappearing. In other words, their entire body was falling apart. And this person regularly went for intravenous baking soda injections. It turns out this is some kind of method approved by the ministry, and even people without medical education are allowed to administer it. I want to warn you, under no circumstances should you take baking soda. Let's not just start taking it like that. In the past, baking soda was prescribed as an antacid for increased stomach acidity. Now, I've heard that modern medicine has eliminated the test for determining stomach acidity. Gastritis, the symptoms themselves, the sensation itself, when you feel a burning in your stomach, the feeling of gastritis, it can occur both with increased acidity and with decreased acidity. And for proper treatment, it is very important for the doctor to know what the patient's acidity actually is, whether it is increased or decreased. For some reason, this distinction, this diagnostic process has now been eliminated. People no longer undergo it. Stomach juice analysis. And now everyone is prescribed antacid medications. This is actually a degradation of medical knowledge and a degradation of diagnostics. It's not some kind of innovation. How can you tell by symptoms whether your stomach acid is increased or decreased? This is an indirect sign. If you have heartburn, do you feel like eating something sour? If you want to eat a lemon, and when you think about it, you really feel like, yes, I would love to eat a lemon right now. Or for example, you drink vinegar, of course diluted in water, never cholesterol. That is diluted in water, slightly acidified water. If you think that it would be good to have some acid, to drink some slightly acidified water right now, and you really crave it, then this is a sign that you actually have decreased stomach acidity. If, when you think about some sour food or drink, for example, a lemon, you feel a strong aversion, then this is an indirect sign that you have increased stomach acidity. Let me repeat once again, in the past, this issue was resolved through analysis of gastric juice. Now, I've heard that this analysis has been discontinued. So what should you do if, when you have low acidity, it's clear? You take lemon or you dilute vinegar and take it, and indeed your digestion improves. But when you have high acidity, should you drink baking soda? Of course, I'm not treating anyone with my videos. And in principle, maybe in some cases of exacerbation, antacid medications are indicated, but in general, the vitamin responsible for the harmonious functioning of the gastrointestinal tract is nicotinic acid. I want to note that vitamins are not medicines. This does not mean that if you have high acidity, you take nicotinic acid and it will lower it for you. Acidity is not a medicine. Moreover, nicotinic acid is an acid, and when you take it, the acidity of your gastric juice increases slightly. And it might seem that if you already have high acidity and then you take more acid, everything will just fall apart, but that's not the case. Vitamins are natural substances that help regulate the body's functions. If we are talking in particular about the functioning of the gastrointestinal tract, and if you have either low or high acidity, you should take nicotinic acid at an average therapeutic dose. For example, according to the instructions for the medication, 50 milligrams. But if you have low acidity, you can allow yourself to take nicotinic acid with food. However, if you have high acidity, you should divide that 50 milligram tablet literally into eighths. And with each frequent meal, you should take a tiny piece of nicotinic acid and eat it. And in this way, gradually, maybe over the course of a week, maybe two, maybe even a month, little by little, your body will start to become saturated with this dose, the average therapeutic daily dose, when you split 50 milligrams into frequent meals. When you have gastrointestinal tract pathology, you cannot eat just once or twice a day. You need to eat 5 to 6 times a day. So when your body starts to gradually take in nicotinic acid after some time, the condition of your gastrointestinal tract will normalize. And then, for example, you'll be able to not just take it drop by drop, but split a 50 milligram tablet in half and take one half with breakfast and the other half with lunch, with food. That's what I want to say. Regarding the use of baking soda, a shift in the blood pH homeostasis can only occur in intensive care conditions and only by trained intensive care doctors. Doctors who literally monitor blood pH minute by minute, who see what is happening and know where to stop. And they know how to bring a person out of acidosis or alkalosis. Acidosis is a shift of blood pH towards acidity, while alkalosis is a shift of blood pH towards alkalinity. So under no circumstances should you ever interfere with your homeostasis in such a crude way. Moreover, it is actually healthy for the blood pH to shift slightly, just a little, towards the acidic side, because it is precisely in an acidic environment. Actually, not even in an acidic environment, to be honest. There really needs to be a safeguard against foolish actions. God forbid anyone starts infusing themselves with acid after watching this video. No, when you just try to nudge your blood pH a little towards the acidic side, that's when bacteria stop multiplying. How can this be done? If you tolerate dairy products, then you should drink sour kefir, for example. As I already mentioned, vitamins are acids, and they slightly, not drastically, it's literally homeostasis being maintained. They slightly shift the blood pH towards the acidic side. And only in this case does a person feel better, experiencing a surge of energy, because metabolic processes in such a situation become more active and healthier, and the blood exchange improves. Cellular processes improve. Gas exchange in the cells becomes better, in part because vitamins are present. Yes, they work, but if you drastically shift the blood's homeostasis towards the alkaline side, the body will naturally try to bring it back. In this way, creating a state of vitamin deficiency for you, it will simply take vitamins from its own systems, and it will simply adjust your blood pH to the level that is needed. If you continue to crudely disrupt this homeostasis, it will keep restoring it. And in this way, you could end up driving yourself straight to the grave. So my friends, honestly, I can't even imagine where this idea came from. It's absolutely unscientific to drip this baking soda, to consume it in unlimited amounts. But I want to tell you, don't play these games. There's a reason doctors study for so long. The body is a very complex system, a very intelligent system. It is a living system that will resist with all the resources it has. It will resist the foolish things done to it. But the body's resources are not limitless. And you need to know how to properly restore these resources. And if you don't know how to do this, if you don't understand the essence of the process that's happening, you can cause so much harm that few doctors will even be able to save you. I urge you not to fall for this bait, for these completely charlatan ideas, and never crudely interfere with your own body yourself. This should be done by competent people, and as for serious emergency measures, those are only performed by intensive care doctors to whom we owe a great thanks. I hope I have answered the question regarding baking soda, how to take it and whether it can be taken. And I hope that some people will think about this, that they will reconsider this issue, stop doing it, and preserve their health. This was Sofya Dorinskaya with you. All the best. Goodbye.